Hi everyone, this is Nitin and welcome to this special video training on the anatomy of an innovative ad for your private practice. Now, I'm going to dissect this ad for you, tell you what's working and what isn't. The first thing that's working for the ad is the headline. Now, all ads need to have a compelling headline because the objective of the headline is to get you to continue reading the ad. Now, the good thing about this headline, no pain, is that it immediately tells the prospect or the patient, or in this case, someone who's driving, someone like myself, that if I want pain relief, then this can help me. And that's all that patients and prospects care for. They care for what you can do for them. They don't really care about our credentials, which is why you'll notice that there isn't really an emphasis on the extent of the certification, the training. In fact, there's no mention of the specific modalities or the specific types of equipment or even the specific treatment methodology in this ad. So if I go out of the ad here, you'll notice again the emphasis is on, like I said, the headline. Now, a lot of people, a lot of patients believe that they have to live with the pain. So these words here, it is possible. I'd give this 5 stars because now this is immediately telling the prospect that you don't have to live with pain. It is possible, and there's a subconscious implication to the reader that it's possible thanks to PMA of NJ.com. So the ad does an excellent job. The headline does an excellent job of grabbing their attention, and then this, these words here, it is possible, is essentially considered a sub headline. And the benefit of the sub headline is that it builds on the impact of the main headline. Now, traditionally, sub headlines are below the main headlines, but in this case, it's adjacent to it because the width of this billboard is excessive compared to the height of the billboard, which is why there's a lot of left to right text. But essentially, this is a sub headline, and the words "no pain" represent a headline. So every compelling ad has a headline that immediately grabs attention and a sub headline that addresses what's going on in the prospect's mind and that builds on the impact of the main headline. Now, in addition to a headline and sub headline, it's important for an ad to have what I call benefits. Now, there's a difference between benefits and features. One of the biggest mistakes I find in ads is that individuals and private practice owners tend to focus on the features. Now, an example of a feature would be we use ultrasound, we use a compression table, we use advanced therapeutic exercise maneuvers. Those are all features. Patients care about the benefits. Patients care about something that's simple, easy, and inexpensive. They care about things like pain relief. They care about things like increased mobility. They care about things like improved strength. They want to get back to work. So now this ad could have done a better job at the benefits, although it does reasonably well at listing the benefits or specifically the conditions: neck and low back pain, herniated discs, treatment of any pain. I like this, treatment of any pain. What I would have done with the ad is I would have put in text like quick and simple and easy pain relief, inexpensive, most likely covered by your insurance, instant appointment, because again, people want fast, simple, and easy, and those are benefits. So I would have emphasized on that instead of listing all these different conditions. But I can see why they've done this because if I had to guess, I'd guess that at least 80% of their patient population has neck and low back pain, herniated discs, sciatica, and are looking for minimally invasive quick recovery. So this makes sense, but if they had emphasized the benefits, they could have attracted a lot more people. Now, another thing that I really like about this ad is the picture right here. Because remember, people identify with people. So what I'm actually going to do is I'm actually going to zoom in on this ad a little bit. So again, people identify with people. So now when I, as a prospect, when I'm looking at this picture, I'm starting to sort of identify and maybe even see myself getting treated or having a consult with Dr. Mikhail Solomonov. So there's what I call personality in marketing, and personality is extremely important in your practice. Specifically for small private practices, it's your personality that sets you apart from some of the larger clinics, from some of the larger chains, and it's your personality that's going to keep patients coming back to you, keep them referring, have them refer their friends and family, have other physicians, other healthcare professionals, even local businesses refer to you because they like your personality. You're not just a nameless, faceless corporate clinic or perhaps even a hospital. So this is extremely important because the image of the person, little things like a clean professional image with a white background, and you can see he has this lab coat on, clean haircut, clean shaven. These little things make a difference and allow an individual to get a sense of what it'll be like to actually get treated by you, even though this has nothing to do with clinical skills and treatment. But that's really how patients tend to judge what they're getting themselves into. There are other elements to the ad. Now, in addition to all this, there's what I call the credibility element. The words here: world-class, expert, and compassionate care. So this is what I call the credibility element, because every time someone sees an ad, they're wondering, do you have credibility? Do other patients know you, like you, and trust you? Have you been featured in the newspaper? Do you have some sort of a testimonial from some well-known person, whether it's a local athlete, maybe someone who's well-known locally, maybe even the local mayor, someone, maybe a real estate agent who has his billboards plastered all over the place. So if he can give you a testimonial, that's what I call borrowed credibility. But either ways, here they've mentioned something that's kind of generic and kind of vague: world-class expertise and compassionate care. Now, anyone can say that. So I would have preferred for them to have specific elements of credibility. For example, featured in such and such newspaper, or featured on television, which I'm sure they have been. If they're putting billboards out there, they could easily do an ad on TV, and if they have an ad on TV that sort of gets combined with a bit of an infomercial, they can legitimately say, featured on television. So they could have done that to make the ad even more effective. I mean, it's a strong ad, but it could have been made a whole lot more effective. Okay, so if you look here, Pain Management and Anesthesiology of New Jersey, that's fine. That's their logo. And this right here is the most important thing at the bottom. Okay, what I call modes of contact. Now, for most patients, the phone is a simple mode of contact. And obviously they can go to the website as well. But they could have done two things that would have made the ad infinitely more effective. The first thing is what I call a call to action. It's a specific benefit that makes the patient want to call. So if they would have said, call today for a free consult, or call today for a free evaluation, or perhaps even call today to get a free book on 3 steps to pain relief. If they would have done something like that, a call to action, and had a very specific measure. Now, when I look at this as a patient, I'm thinking, okay, this is a toll-free number. I'm probably going to be another statistic for them. But if they had a call to action, and if they had what I call a specific measure, here's what I mean by that. If they had something here that said, call Sarah at at a local number, 201, let's say 723-1245. If they had a local number, and if they had a specific measure, the ad becomes a lot more personalized. So if they had a call to action, call Sarah for a free book on 3 steps to reduce pain at 201 and a local number, their response would have shot up. Now, I'm assuming they use this ad because they have their ads all over New Jersey, so they wanted to keep a toll-free number. Besides, I'm not a big fan of 855 numbers. Anyway, they should have used a local number, because that again would have made the prospect or the patient feel, okay, this is local to me, and not just another big company and I'm going to be another statistic. So I hope all of these tips and all of these suggestions have been helpful for you, and good luck creating your own compelling, innovative ads to grow your private practice. Thank you so much for watching.